I'm Brister Shum, and my dog is Spur. He's a beautiful 3-year-old golden retriever. He is our youngest son now. Spur's a very active golden retriever, as most golden retriever puppies are. And he's the kind of dog that would eat crayons, eat socks. On Christmas Day, he completely quit eating. So instead of having Christmas Day, we took him to the emergency vet clinic, and it was determined that he had blastomycosis. What this disease is a fungal infection where the dog sniffs a spore, a microscopic spore, and it turned into an infection in his lungs, in his skin, and in his eyes. And his diagnosis was guarded. He was a very, very sick dog. Dr. Kenny is our family vet, and initially Dr. Kenny just wasn't sure what it was, but he's known Spur since he was born, and he said this puppy's just not right. So Dr. Kenny's the one that referred me to the veterinary specialists who were able to do additional testing.
Well, we're just real fortunate here in this area to have a specialty hospital close. And we do refer a number of cases over there. In most cases, it gives a good outcome. I've never had a client not appreciate that.
Like most things, it's a team approach. Dr. Kenny recognized that it was a fairly significant eye problem. He and I have a great relationship. He sent Spur in, and once I saw Spur's problem, knowing Dr. Kenny as I did, I knew he would not care in the least if I got the very best possible care for Spur, and which is why I contacted Dr. Bayless.
His initial treatment started with antifungal medications to basically kill off those fungal organisms. His first several days in the hospital, he was very compromised. He had a really difficult time breathing. His color wasn't good. It was a little bit touch and go. I think he stayed with us for about 7 days in the hospital. And since then, he's been getting progressively better. And now he is a very normal dog. So if you saw Spur now, you would have no idea that he's ever been through anything like this or that he's sick at all.
Well, Dr. Bayless was actually one who was able to hold my hand all the way through it. So she was able to tell me, this is the prognosis, this is what we think is going to happen, and this is what we're going to do step by step for the next 4 to 6 months. So I felt like I was well informed the whole way and actually had an advocate. It was very nice having that relationship, actually a personal relationship with a specialist.
ACVIM is the College of Veterinary Internal Medicine, and so internal medicine specialists are doctors that have completed veterinary school and then gone on to do an internship usually, as well as a residency in internal medicine. And so we see actually a pretty good variety of cases, anything from infectious disease to endocrine disorders, respiratory diseases. So it's a pretty broad specialty, but it's all strictly internal medicine.
I feel like Spur got the best treatment that he would have gotten anywhere in the world. I just strongly recommend that if anything unusual happens to your pet, encourage your family vet to send you to a specialist and ask questions, do your research. Don't just hope that it gets better. Push just a little bit and develop that relationship with a specialist, because that's why we have a dog today.